Welcome to our annual members meeting, which will provide you with an overview of the achievements of Clatterbridge Cancer Centre from April 2019 to March 2020. I'm Cathy Doran, and I'm proud to be the chair of the Clatterbridge Cancer Centre. These are indeed extraordinary times that we're living through, and this is the first time we've not been able to meet in person for our annual members meeting. In the early months of 2019, we saw the emergence of the COVID-19 pandemic, and it became clear very quickly that this would have an effect on our cancer patients and the way in which we provide services to them. During the course of the last year, we've built upon our highly ambitious priorities within our strategy, and I'm delighted that our new flagship cancer hospital in Liverpool opened in June 2020 to enable us to deliver a wide range of highly specialised cancer care. This was a true feat in the middle of a pandemic. 2019-20 has been a very positive year for the Trust, and we are extremely proud of the way in which our staff have worked tirelessly to ensure that our patients receive the best care possible. Our annual report and accounts are available on our website. The first aspect of business I need to deal with is the matter of the minutes of last year's meeting held on the 25th of September 2019. Those minutes have been available on our website, and they're now taken as an accurate record of that meeting. The next piece of formal business that I need to inform you about is the result of our recent governor elections, which took place over the summer. I'm delighted to welcome back John Roberts as Public Governor for Liverpool, and he's returning to us following a break for a year. We also have seen re-elected two other governors, John Field, the Public Governor for Wirral and the rest of England, and Deborah Spearing as one of our non-clinical staff, and welcome back to both of them. I'm delighted to inform you of some changes to our Trust Board with the appointment of the following. Professor Terry Jones has been appointed as a non-executive director. He's also director of the Liverpool Head and Neck Centre and chairs our Quality Committee. Elkan Abrahamson has been appointed as non-executive director, and he complements the board with his strong legal background. And in addition, we were able to welcome Jeff Broadhead, who had joined us originally as an associate non-executive director in 2018 and was made a full non-executive director in July 2019. Over the same period, we said goodbye to two of our nets, Mark Baker and David Teal, and I'd like to thank them both for the invaluable contribution which they made over the years. I'm also required to inform you of any changes to our constitution, and in November 2019, Sarah Barr, our Chief Information Officer, joined our board as a non-voting member. We have two governor subcommittees, the Membership and Communications Committee, who've been looking at the wider aspects of engagement with our membership. We currently have 6,373 members, and we would love to increase that number going forward. Please encourage friends and family to consider joining us. Our second governor subcommittee is patient experience. The governors have been actively involved in the Trust Patient Experience and Inclusion Committee despite the restrictions posed during the early stages of the pandemic. Those restrictions have meant that we're not able, as governors and non-executive board members, to visit the Trust facilities in person, but we are exploring ways of keeping connected with staff and patients using technology. On behalf of the board, I want to thank you for your interest in Clatterbridge Cancer Centre and the work we do. Our Chief Executive, Liz Bishop, and Director of Finance, James Thompson, are going to tell you more about our performance in 2019-20 and our plans for the year ahead. Thank you once again for listening.
Hello, I'm Liz Bishop, Chief Executive of the Trust. It's been an extraordinary year with COVID-19 and the opening of our new cancer hospital in Liverpool. I'm going to take you through our performance in 2019-20, including our quality accounts and events since then. I'll also give you an overview of our next 5-year strategy for 2021 to 2025. So last year in numbers, well, we cared for over 32,000 individual patients. That was over more than 270,000 different appointments, treatments and inpatient stays in hospital. Over 9,000 of those were inpatient episodes of care, large volumes of radiotherapy and chemotherapy treatments, and of course diagnostics. Key developments last year, well, inevitably in the last months of the year, they were dominated by two things. The final preparations, of course, to open our new flagship hospital in the middle of Liverpool. The second was the COVID-19 pandemic. I'll say more on those topics later, but there are some other key developments that I just want to mention first. The first is about the Cheshire Merseyside Cancer Alliance, which we've hosted since the alliances were developed several years ago. The Cancer Alliance of Cheshire and Merseyside brings together all the providers of cancer care, from prevention, screening, diagnostics through to treatment. As part of our commitment at Clatterbridge to be a system leader for cancer care, working closely with all partners, including GPs and our screening teams and the acute hospitals that provide surgery. It's important that we look across the whole cancer pathway so that people in our region get the right care as early as possible. We have around 1,500 staff, and allied health professionals, such as radiographers, are the largest staff group. They play a vital role, which is why we appointed our first allied health professional lead, Linda Williams, last year. She's a key part of our leadership team. She happens to be a diagnostic radiographer, and along with our chief pharmacist, our director of nursing and medical director, she's really helped strengthen our clinical leadership. So many thanks to her. In 2020, it was the year of the nurse and the midwife. We launched a very successful new nursing careers pathway. We've had very successful recruitment campaigns for the new hospital. And, our nursing staff featured in a special edition of This Morning, celebrating nurses and midwives and showing them at work. We were also part of this year's hospital series on BBC Two, with one episode in particular focusing on immunotherapy treatment in one of our patients. With regards to research and innovation, we've had a very successful year. We've recruited more than 1,200 patients to clinical trials, the highest number ever, and that was against a target of 1,000. We've got a new leadership team. We've strengthened our tumour group's research leadership, and our study setup times have reduced to a median of 27 days, which is well below the national target, which means we've got better access for patients and less delay. Our staff also played a key role in LHP, which is Liverpool Health Partners, Spark, which is a new shared service, making Liverpool attractive for pharma and other research partners. We were very proud to say that we were in the top 10 trusts nationally in 2 categories of the National Research Activity League tables and finalists in the North West Coast Clinical Research Network Awards. We have a new clinic set up just for early phase clinical trials, phase 1 trials as they're called, and we're about to lead a phase 1 study which would not have been possible to lead this without the new hospital in Liverpool. We continue to be supported by our charity, and our subsidiaries as well play just as an important role as our other staff. They provide vital support for us. Research is just one example. They support. The charity provided 250,000 innovation funding, including initial funds for 3 key studies on COVID and cancer. One of those being a CCP Cancer UK, led by our very own Professor Carlo Palmieri, and believed to be the largest study globally of its kind. The charity raised more than $3 million last year for the trust, and the team have played an incredibly important role during COVID, supporting our patients and staff, providing pamper packs for patients, for example. So many thanks to our charity team. All charities, sadly, are feeling the impact of the pandemic, but our charity team have been very innovative. For example, setting up drive-in movies to raise funds for our cancer patients. Our subsidiaries, well, just to mention pharmacy, they also played a key part in our response to COVID, establishing very quickly a new home delivery service with volunteers driving around Cheshire and Merseyside, taking treatment to patients who didn't have anyone who could collect it for them. So many thanks to pharmacy and the volunteers. They also managed during COVID to open the new dispensary in Liverpool, as well as keeping this one going at Wirral as well. So thank you to the pharmacy team. Our Clatterbridge private clinic continues to benefit the NHS because those profits are reinvested back into our services. We open the new clinic in Liverpool shortly. And finally, I'd just like to talk a little bit about Prop Care, which is our property and estates subsidiary company, absolutely pivotal to the new hospital. Project managed it in exceptionally challenging circumstances, and we could not have achieved the opening of the new hospital without them. In terms of the new hospital, well, the new hospital serves the 2.4 million of Cheshire and Merseyside. We opened it on the 27th of June. We had a lovely video message from His Royal Highness, the Prince of Wales, which thrilled our staff and patients. The new hospital is across 11 stories and part of a £162 million investment into cancer care. It's really transforming the way we give care, centralised and highly specialised services. It's got 110 single inpatient ensuite rooms, also important during COVID, so we can protect and isolate patients at risk. We provide chemotherapy, immunotherapy, radiotherapy, and of course specialist diagnostics as well. We are co-located with the Royal Liverpool, so that's great for patients because we've got critical care services, surgeons on our doorstep. Many thanks to the Royal Liverpool Hospital who helped support the opening as well. And of course we're co-located to the university, which helps facilitate our research programme and help to expand that research programme. The plans date back for more than a decade, so it's been a huge amount of work, delivered on time and on budget, despite hugely challenging circumstances, as I mentioned, during the lockdown and during the pandemic. So enormous credit to our staff, to Prop Care, and all our partners, including Lang O'Rourke, our contractor. With regards to COVID-19, well, I think we would all say it's a challenge unlike any we have known before. Many people with cancer are particularly high risk, so we had to transform the way we delivered our care very quickly. We accelerated all our innovations. We were already a global digital exemplar. With advanced use of IT and technology, we were well placed to move at pace. So we mobilised video consultations, electronic prescribing, electronic consent, enabling staff to work from home and flexibly very, very quickly. We maintained care throughout the pandemic. We brought in new drug regimens to reduce risk. We condensed radiotherapy treatments to minimise the number of visits. And we set up a COVID helpline offering treatment and support for patients with cancer. The Cancer Alliance role in the pandemic was pivotal, coordinating cancer services across Cheshire and Merseyside, recovery of activity from Wave 1 and maintaining activity throughout Wave 2. They also coordinated the mutual aid across other trusts, and our mutual aid to the system would not have been possible without the new hospital, which gave us additional capacity in terms of diagnostics and treatment. In terms of our operational performance, well, I'm very pleased to say, we were one of the top hospitals in our national inpatient survey, and we perform well on national waiting time targets. We fully achieved the 18-week referral to treatment targets. We've achieved the 62-day cancer waiting time targets, except for the months of August and January, which is partly related to patient choice at that time of year. We achieved the 2-week target in 9 months out of the 12. We didn't achieve our inpatient length of stay targets. That's been revised for 2021, and our patient flow teams are reviewing that now. But in many cases, it was a clinical decision to keep patients in for more investigations, which of course is absolutely the right thing to do. In terms of quality, well, pleased to say we've had 0 never events, 1 case of MRSA, 11 cases of Clostridium difficile, and 8 cases of Pseudomonas throughout last year. We've strengthened our freedom to speak up. We've got more guardians in place. We've done a campaign to raise awareness. We've had 21 contacts, all of which have been resolved. We've participated in the national quality audits that we're eligible for, 16 national clinical audits, 1 national confidential inquiry. We continue to review all deaths in line with Learning from Deaths framework. And earlier this month, our staff, our team were highly commended in the HSJ Patient Safety Awards for their work on learning lessons from mortality. So we're very proud of them, and many thanks to them. We've had many very successful recruitment campaigns. I've already mentioned nursing, but it's across the board really, also medical, allied health professionals and non-clinical staff as well. Looking to the year ahead, well, we're now embedding a new clinical model. Now the new hospital is open. We have plans to refurbish the Wirral site, that's underway, and we continue care at all our sites, Aintree and the wider network is very important. We continue to work as a system through the Cancer Alliance and the wider NHS so people get the best cancer care, and it's important to keep improving outcomes through earlier diagnosis, access to services and clinical trials and new treatments. So our next 5-year strategy, well, it's not surprising that our mission is to drive improved outcomes and patient experience through our unique network of specialist cancer care across Cheshire and Merseyside. And that means that we are aiming to continue to be outstanding in the care that we deliver. We'll work collaboratively with all partners, delivering better outcomes for cancer patients with our network model. It's really important that we work hard to respond to any staff feedback through our staff surveys, that we continue to improve on our staff survey responses and really build on that platform of being a great place to work for our staff, so that we retain our staff and attract new people. I talked about our digital preparedness. We'll strengthen that through the next 5 years. I've talked about our research, which will continue to grow. And of course, we will need to be innovative to deliver new models of care, to deliver all that we do. We will be working next year to refresh our trust values, and we'll engage with all our staff to do that next year. So these are just some of the key developments last year. We have a short video later that shows more highlights from the last 12 months. It's been a challenging time for everyone, but we're very, very focused on what we need to do now and going forward for our patients and staff. So thank you for watching our annual members meeting and for your interest in our trust. Stay safe and best wishes.
Hello, my name's James Thompson and I'm the Director of Finance at the Clatterbridge Cancer Centre. And as part of this virtual annual members meeting, I'm going to present the 2019-20 accounts and present the key financial highlights from the year. 2019-20 was another successful year for the Trust and builds on their history of financial stability and investment in patient services across the whole network. The Trust delivered a £4.9 million surplus in the year and achieved its NHS improvement control total of £3.1 million surplus. It also received £7 million worth of donations from the Clatterbridge Cancer Charity and overall spent £56.3 million on capital projects across the whole of the Clatterbridge estate. The accounts themselves are presented in a group format, so include the financial performance of the Trust's 2 wholly owned subsidiary companies, PropCare Limited and the Clatterbridge Pharmacy Limited. They also include the results from the Clatterbridge Cancer Charity. From the highlights from the audit in 2019-20 are that the Trust is a going concern, so the Trust has enough assets and cash to pay for its obligations and payments over the next 12 months. The Trust also completed an asset revaluation exercise in the year, and in the opinion of its external auditors, Grant Thornton, the accounts present a true and fair view of the financial position. The accounts were modified because the auditor couldn't verify the stock count in the pharmacy at the end of 2019-20 because of the COVID pandemic, so it had to amend slightly its opinion in the final accounts. The Trust did, however, receive a value for money unqualified opinion which means that in the according to the auditors, the Trust does provide services that are efficient and effective. So, what do we spend our money on, and where did it come from in 2019-20? Well, in 2019-20, our income overall increased by 15%, leading to a total income position of £189.4 million. 142 of this was from NHS commissioners and goes to pay for direct patient care. So all our treatments that we provide for patients are paid through the commissioning route. That includes NHS England commissioners and also local clinical commissioning groups too. In terms of expenditure, the Trust increased its expenditure year on year by 18%, and the total operating expenditure for the year was £179.6 million, of which £67 million was staff costs and £68 million worth of drug costs, which are the two largest items in our cost base. Staff costs increase relate to staff pay awards and funding of pension increases. They also increase because the Trust has invested in increased staffing numbers for the new in advance of the new hospital opening in Liverpool. And the drugs increase, again around about 18%, is driven by the volume of patients that we saw in 2019-20. So we saw more patients in the financial year, and also the range of drug therapies that are now open to patients. So we're seeing more complicated drug treatments that patients are benefiting from, and that's increasing our costs in the year. In terms of capital, the Trust spent £56.3 million on capital during the year, and predominantly this was spent in Liverpool on the new cancer hospital. It didn't open until July 2020, but we spent a lot of our money building up to that, obviously. And in 2019-20, we spent £51 million on the new building, and we spent a lot of money in the previous years as well, building it up from out of the ground on the Liverpool site. The £51 million that we did spend on the new build includes a charitable donation element of £7 million, which was made for donated for equipment. So we've equipped with support from the charity, which has been very helpful in providing a good level of equipment and specification for patients to definitely get the latest treatments. So looking forward to 2021, it's clear that COVID has had an impact in the Trust. The Trust has been funded for its costs by the NHS system, so it's still in a financially stable position. And for the first 6 months, it was receiving funding equal to its costs. So extra costs relating to COVID were covered financially. For the second half of the year, in 2020-21, the outlook is that the Trust will again have financial stability and is aiming for a break-even position. And the Trust is funded now based on its historic cost base with an extra allowance for COVID and for increases in patient activity in the second half of the year. Looking forward further into 21-22, I think it's fair to say that the NHS financial system is currently being reviewed, and it's likely that in the future some of our commissioning relationships will evolve into a system-based approach. So we'll be working with partners across the Cheshire and Merseyside system to ensure that our funding levels are sufficient for allow us to invest in patient services, and also to reflect the fact that we're doing lots of work in aiming to be as productive as we can. So all the investment that we've made in Liverpool and across the Clatterbridge network provides efficient and effective services. So that is the financial update for the annual members meeting. Thank you for tuning in, and see you again next year.
new facility opens its doors today, I simply want to send to all those who work and all those who will be treated there every possible good wish for the future.
Hi, I'm Claire, a matron here at Clatterbridge Cancer Centre. We stay here for you. Please stay home for us. Protect the NHS and save lives.